Today I released a paper on the intergenerational implications of how we pay for healthcare and what we need to do to sustain the system that we have. We know with population aging that health spending will be higher, but to date most people have dismissed it as unimportant or not an important driver of healthcare costs and therefore something we can ignore. We were worried about that, so we took a look at it to find out just what the tax implications were of the modest increase in health spending arising from population aging alone. And to our surprise, it effectively doubles the level of indebtedness of the Canadian provinces and territories. The reason why this occurs is because of the way we pay for health care. We collect taxes from people when they're working, typically between 20 and 65, and we spend on them typically after age 65 when their health care needs rise. When you have a population where we have an equal number of younger people to older people, this is not a big problem. But when you have a large generation like the baby boom, we have for a while a lot of taxpayers who are not paying a lot each to pay for the old generation at that time, but then they're followed by a smaller generation that's going to have to pay much more on average to pay for the healthcare costs of this much larger generation. The effect of it is we know we're not collecting enough tax today to pay for the spending that we promised. The perception might be that these would be small numbers because healthcare costs are only going to increase 1% per year with population aging. What we find is that effectively the underpayment of the baby boomers at birth was a gift of $4,000. But if you compound that to their current ages, the level of debt or birth gift that we gave them, if we were to retire it, is over $35,000. So if you think student debt was a problem, think about retiring this liability through the tax system. More importantly, if we think through what we're doing to future generations, they're being born into a net paying situation if they agree to pay these taxes. The current generation seems to have a gambling model in mind for sustaining health care. What they're gambling on is the future taxpayers, who are fewer in number, are going to agree to the tax levels that are necessary to pay for what they think they have coming. This could occur, but on the other hand, future generations might look at Canadian Medicare that the baby boomers have failed to fix in terms of what we're spending on and say this is just too expensive. So in other words, if you want to fix this system, you have to start thinking through the political implications of the intergenerational transfers, and you have to think about how you take the burden off of future taxpayers' bank accounts and putting it back on to the baby boomers who have not paid enough to date. Some of the ways that we could look at reducing this future burden is first, let's just put a tax on the baby boomers. Now, if the baby boomers are comfortable with their current debt loads, taking another $2,800 per person per year, so for a family of four, remember this is over $10,000, you can take that $10,000 on top of the taxes you're paying now, and that will be set aside to pay for your future health care needs. We don't believe that at this point that's a realistic approach. So another one is, let's spread the burden around. Let's just charge every Canadian $2,000 to retire the aggregate implicit liabilities of the baby boom generation. We haven't really solved the intergenerational problem, we just moved it from our grandkids to our kids. And what we've also done is we've taken a large tax or surtax on a generation that's coming along, and this is still going to be in the context of their paying for everything else. Are they going to agree to this? So what we're left with is something that governments don't want to think about, that they've been told for over a decade through the various commissions, Romano, Kirby, and Mazankowski, figure out how to spend better. You have lots of money in healthcare, figure out how to make it go further. Why are we relying so much on hospitals and doctors to provide care for seniors and people with chronic conditions? What we calculate is that if we could eliminate with a magic wand the 40% of preventable chronic conditions, we could reduce health spending sufficiently to completely eliminate the intergenerational imbalance. The returns to this approach, healthcare reform, which governments were told over a decade ago to get serious about, remains the only reasonable way at this point to fix this. The real question that's going to be posed through history to the Prime Minister and the Premiers at this point is, why didn't you get serious about this much sooner if you wanted to save it? They won't be Tommy Douglas bringing it in, they'll be known as the one who took it out, unless they can figure out how to solve this problem, and now. I'm Herb Emery, this is the School of Public Policy. Thank you for watching.